Celeste Luna. I'm a marketing strategist at BSA. Today I'm joined by Dr. Cheryl Williams. She's one of our hospitalists as well as our medical director of quality. We're going to be talking about stroke for Stroke Month. So Dr. Williams, the first question I have is, what does the term time is brain mean?
Time is brain because when someone has a stroke, you're losing about 1.9 million neurons per minute. When you're depriving the brain of oxygen, your brain is dying. That's why it is so important that when you first see the signs of a stroke, or in yourself or in someone that you're with, immediately you need to be calling 911. The important thing to remember is that little acronym that the American Stroke Society has put out. It's called FAST, F-A-S-T. F is face. Do you see any drooping of the face? A is arm. Is there any weakness in the arm or hand of the patient? Speech. Is the speech slurred, or does the patient appear confused? They can't answer your questions. They don't know what's going on when normally they would. If those are happening, then T, it's time to call 911. Don't think it's going to go away in a few minutes. Don't think that you could just get in the car and drive to the emergency room. Call 911, get an ambulance, get to the emergency room as fast as you can, because then we can start doing treatment as fast as we can to save as much brain as possible.
Before a stroke happens, what can we do to kind of prevent that and reduce our risk?
The best way to deal with the stroke is to never have it happen. Stop smoking. That is one of the major risk factors for stroke. Control your blood pressure. A lot of people have high blood pressure and they don't even know it. You need to go to your physician and have your blood pressure checked. Go to a health fair, get your blood pressure checked. And if it is high, it needs to be controlled. That is a major risk factor for stroke. High cholesterol is another major risk factor. Again, go to your physician, go to a health fair, go somewhere, get your cholesterol checked, because if we can manage your cholesterol, you're reducing your risk for a stroke. The best way to manage blood pressure and cholesterol right off the bat is not necessarily medications, it's diet and exercise. Obesity is also a major risk factor for stroke. Diabetes is a major risk factor for stroke. And trying to control that with lifestyle modification, diet, exercise, getting enough sleep, all of these will reduce your risk of stroke.
Another thing that I read is that women die from stroke about twice as often as they die from breast cancer. So why is that, and what can women do to kind of prevent that from happening?
Women have a lot of risk factors that the general population has, but we have some particular risk factors that are special to women. 2 out of 5 women do have high blood pressure, and half of those people do not have their blood pressure controlled. So number one, again, we need to control our blood pressure. Women live longer than men. So statistically, guess what? There's more of us at an older age, and guess what? Stroke increases as you get older. So that's another reason women have more strokes. Certain populations of women are even at higher risk. The African American woman is at high risk for stroke, again, because of a high prevalence of high blood pressure and a high prevalence of uncontrolled high blood pressure. They also have higher rates of obesity and diabetes. The Latin American woman is also at risk for stroke because of higher rates of hypertension, diabetes, and obesity. Again, no matter what population you're in, you need to control your blood pressure, you need to stop smoking, diet, and exercise to control weight and blood pressure. Those are the major things you need to think about doing.
Somebody presents to the hospital with a stroke. What are the services we offer?
The important thing to remember is that we are a stroke center, and so we have been accredited by the DNV to be a primary stroke center. That means that we have shown the quality measures that we can treat an acute stroke quickly and very well. We're also an American Heart Association Gold Plus Quality Award winner. When you hit the door with an acute stroke, you're going to be taken immediately to the CAT scan, because we don't know what kind of stroke you're having. It could be a bleed in your brain, or it could be an occlusion of a blood vessel going into your brain. The treatments are totally different. We're going to be measuring your cholesterol, we're going to be looking at your blood pressure. Now immediately in a stroke, we're going to let your blood pressure run high. But after a day or two, we need to get that blood pressure controlled because that is a major risk factor for more strokes. So we're going to be assessing you for rehabilitation. The outcomes of stroke can be minor. They can be a little bit of a droop on the face, or it can be major hemiparesis. It all depends on how fast we were able to treat it, how big the territory that it was affected in the brain. Minor strokes, you can usually go home on preventative medications. Bigger strokes require rehabilitation.
Well, thank you so much for joining me today. Everybody stay safe and have a good day.
Thank you.